A 59-year-old woman presents to her GP with a 2-week history of worsening jaundice. She has noticed intermittent right upper quadrant pain associated with eating fatty foods and generally feels tired and drained. Her past medical history includes ulcerative colitis, controlled with oral mesalazine, and primary sclerosing cholangitis, for which she is taking cholestyramine to control itching. Physical examination confirms the presence of jaundiced sclera and skin. There are no masses or tenderness on abdominal palpation. Weighing the patient reveals that she has lost 5 kg since her last appointment 4 weeks ago. That's quite a drastic weight loss. What is the most likely cause of this patient's symptoms? Is he having a cancer? Okay, so let's look at the stem again. 2 weeks history, worsening jaundice. So what's causing this jaundice? Could be obstruction of the biliary tract for 2 weeks. Right upper quadrant pain associated with eating fatty foods. This is chronic cholecystitis. Because once you eat fatty foods, your bowel contracts to secrete your bowel to digest the fats, because your fat emulsifiers are in your bowel. So as your bowel contracts, it causes pain. Generally feels tired and drained. Her past medical history includes ulcerative colitis, PSC, cholestyramine, control itching. But her massive weight loss, I want to suspect cholangiocarcinoma because the risk is increased in someone who has PSC or primary sclerosing cholangitis. As well, the weight loss 5 kg in 4 weeks, and feeling tired and drained. These are all sinister symptoms. And cholangiocarcinoma can also explain the 2-week history of worsening jaundice, because cholangiocarcinoma causes a blockage of the bile duct. Let's look at other options. Ascending cholangitis. She doesn't have fever, does she? Ascending cholangitis, there is someone named this set of symptoms after themselves. I think it's Rolfsing or something. I have to study that later. There are 2 signs. Never mind. Pancreatic ductal adenocarcinoma. Possible as well. However, cholangiocarcinoma is more likely given that she has PSC. Hepatocellular carcinoma, also possible. I don't know, man, it's possible. And cholecystitis. She does have chronic cholecystitis, but that's not the main issue now. I'm gonna guess cholangiocarcinoma. These 2 are also possible. The answer is cholangiocarcinoma. Cholangiocarcinoma develops in around 10% of primary sclerosing cholangitis patients. So cholangiocarcinoma is an important complication of primary sclerosing cholangitis that affects up to 10% of PSC patients. It presents with jaundice, weight loss, pruritus, and persistent biliary symptoms. PSC confers a slightly increased risk of hepatocellular carcinoma if the patient has cirrhosis. However, cholangiocarcinoma is far more common. No studies have shown a convincing link between PSC and pancreatic cancer. The weight loss and persistent jaundice point to a more serious pathology than cholecystitis, whilst ascending cholangitis would have infective features. So PSC, think of cholangiocarcinoma. Increased risk of colorectal cancer as well. They also have increased risk of hepatocellular carcinoma, however it's less common than cholangiocarcinoma. Right, what did I want to study about? The eponymous syndrome of cholangitis. Reynolds. Yes, so this guy named Reynolds named this pentad after himself. Reynolds pentad is a collection of signs and symptoms suggesting the diagnosis of obstructive ascending cholangitis, a serious infection in the biliary system. This is a combination of Charchot's triad. So Reynolds and Charchot's. Charchot's triad is right upper quadrant pain, jaundice, and fever. And then Reynolds pentad, he added 2 other symptoms and named it after himself. These are shock with low blood pressure, tachycardia, and altered mental status. Charchot's triad suggests what? Is it cholangitis as well? Charchot's triad, cholangitis as well. So both Charchot's triad and Reynold's pentad suggest ascending cholangitis. However, Reynold's pentad is a more serious one already. So Charchot's triad includes fever, jaundice, and right upper quadrant pain, right? Fever, jaundice, right upper quadrant pain, and fever with rigor and right upper quadrant pain. Okay, Charchot's triad is fever with rigor, jaundice, and right upper quadrant pain, and then you add 2 more symptoms, which is shock. You can see through hypotension and tachycardia, and the other one is altered mental status. You add these 2, you call it Reynold's pentad. It's also pointing to ascending cholangitis, however it's more severe. Right.